TJ Hockenson of the Minnesota Vikings suffered a knee injury yesterday where he was hit by a defender in that knee area, and he was actually able to limp off of the field. However, at the time, there was some speculation that the Minnesota Vikings were preparing for the worst, that they were preparing for some sort of damage to come up in advanced imaging for that knee. It looks like, unfortunately, today that it is confirmed that he is dealing with an ACL and an MCL tear, and he is projected to miss the remainder of the season. With today's video, we're going to look at the play that he was injured on and talk about the knee position that his knee went into and why this is very risky for an ACL and MCL tear, as well as some other potential structures to the knee. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo, and I'm a doctor of physical therapy. With my channel, I take a look at sports injuries and I explain them so that they're a little bit easier to understand. I also go over the relevant anatomy of those injuries, as well as talk about what that person should expect when moving forward. If you like this sort of content and you want to see more of it, please hit that thumbs up and subscribe to the channel, because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you yourself have dealt with an ACL and or an MCL tear, go ahead and comment on your experience in the comment section below. Now we can see here on the injury replay that as Hockenson catches the pass, he's going to turn and run downfield. As he does this, the defender is going to come in and make contact with his right knee. So here I have a model of the knee joint, and it's important to know that the knee joint is formed by the top portion being that femur, also known as the thigh bone. It's going to come on down right here. Then the bottom portion of the knee is formed by the tibia, also known as the shin bone, coming up like so. And as we flip the model laterally, we also have that fibula bone that's also going to be in the lower leg. There are four main ligaments that contribute to overall knee stability. The first one being that anterior cruciate ligament, also known as the ACL for short, located right in through here. As we flip the model medially or towards the inside portion of the knee, we have the medial collateral ligament, also known as the MCL. Then as we go ahead and flip the model laterally or towards the outside portion of the knee, we have the lateral collateral ligament, also known as the LCL. And finally, as we flip the model to the back, we have the posterior cruciate ligament, also known as the PCL for short. And as we look further in the model here, we have two pieces of fibrocartilage. They are the medial and lateral meniscus. You can essentially think of those as shock absorbers between the femur and the tibia bones. There are two main motions at the knee joint. The first one being flexion, where the knee is going to bend like so. And the opposite of that is going to be extension, where the knee is going to straighten just like that. Taking a look again at the injury replay, we see that as the defender hits Hockenson's knee, it looks like his knee is going to go in something known as hyperextension. So anytime we talk about hyper, this means it's beyond the norm value of whatever we're talking about. In this case, hyperextension, it's going beyond the norm value of extension. So as I do this, you can see on the model here that it's essentially stretching and stressing all of those structures located in the knee. The first one that's affected greatly in this position is, of course, that ACL. And this is because when you're taking somebody beyond their norm value of extension, it's going to essentially place that shear force going through the ACL. The MCL, of course, is also affected in hyperextension positions. However, what's interesting in this case is it looks like as the defender is making contact, he's actually a little bit more laterally, and this is causing a force going essentially anterior to medial. And anytime we do this, it's also placing a valgus force, which is going to essentially gap the inside or the medial portion of the knee, which can also greatly affect that MCL. The other knee ligaments can also be affected in severe hyperextension positions. However, in this case, once again, we only know that the ACL and the MCL have been affected. It's also important to say that the meniscus can also be affected in this position, because as we're going in hyperextension like this, it's going to pinch the medial and or the lateral meniscus as well. It could also lead to a tearing, especially with any sort of shearing force going through those bones there. So as of right now, it doesn't look like the meniscus has been involved, but it's important to know that it can also be damaged in these positions. We do have an on the field or in the clinic test to determine if somebody is dealing with an ACL tear. And the gold standard in the clinic for this is the Lockman's test. And so what we're going to do is we're going to stabilize the person's thigh. And what we're going to do is we're going to pull on that tibia bone. And as we do this, if we feel like this motion is a lot more lax compared to their non-injured side, then this makes us think that we're dealing with an ACL tear. There's also a test we can do in the clinic for MCL injuries, and this is a valgus test. And so what we're going to do here, once again, we're stabilizing that thigh and we're placing a valgus force, so a force coming from the outside coming in, And as we do this, if we see that MCL essentially is gapping and there's a lot more motion and it's reproducing the person's pain, compare it to the other side, then this also thinks that we're dealing with an MCL injury. Hockenson's injury, of course, was confirmed by the absolute gold standard for these ligament injuries, and that is the MRI. And this takes us to the grading system of ligament injuries. So for a ligament injury, you have grades 1, 2, and 3. In a grade 1 ligament injury, this is where you're getting stretching of the affected ligament. In a grade 2, this is where you're getting partial tearing. And finally, in a grade 3, this is where you're getting a full rupture. Full ruptures of the ACL require a surgery known as an ACL reconstruction, and this is because the ACL is completely severed, so they need a graft to essentially go back in there and create a brand new ACL. If the MCL tear is bad enough, they'll go back in and surgically repair that MCL as well. It really just depends on how lax the knee is and how unstable the joint is. When we get somebody in the clinic after an ACL reconstruction, it really depends on what else is being done with that surgery, because if anytime a meniscus repair is involved, for example, the person is going to have more weight-bearing restrictions. So that's some information that we need to know. But as soon as we get somebody in the clinic, they're going to be in one of those big giant braces known as a drop lock brace. And this is because immediately their quad is very weak. And so we need to start working on re-educating the quad muscle as well as restoring some of that range of motion. As the person starts to get their quad stronger, we can start to unlock the brace and work more on full weight bearing, also known as weight bearing as tolerated. It really depends on the guidelines that the surgeon has outlined. And then from there, as they've gone through their follow-up appointments and the person is progressing well in therapy, we can start to slowly work in more strengthening motions, a lot more with stability work. And then finally, when it is appropriate, we can start to work in sport-specific movements, but this is usually around about the 5 or 6 plus month mark. So unfortunately for Hockenson, it looks like he is going to have a long road ahead of him in terms of the actual recovery process. As of right now, it's uncertain as to whether or not he's going to make the start of the season next year. Usually these injuries at about the 9 to 10 month mark, they can start to return to sports, but it really depends on how that person does with the whole rehab process. So I'll have to wait and kind of see how his follow-ups go and see if we get any more information about his rehab. If I happen to hear anything, I'll be sure to update everybody in the comment section. Also, if you happen to hear any updates, please feel free to update us as well. So we wish Hockenson the best of luck moving forward with his recovery process. Thank you so much for watching my video today. If you enjoy this sort of content, I'm going to go ahead and link another one of my playlists so that you can watch some of the other injuries that I've talked about in the past. Thank you for tuning in, and I'll see you next time.